Today on COVID-19 Local Impact, a tumultuous trip home for one Peterborough resident.
When we first got on the first flight, people were not necessarily separated right away, so there was a whole bunch of people at the back that were all sitting beside somebody else after we'd all been separated going to the airport.
Economic impacts affecting the municipality of Port Hope.
And the economic impact is becoming, a significant one for municipalities.
And Premier Doug Ford promises more information will be coming this week.
And later this week, we'll be releasing the next step in this process.
Hello and welcome to COVID-19 Local Impact on Your TV. I'm Dan Malta from the Your TV studios in Peterborough. We'll start today's show with a quick look at the COVID-19 stats from the area. Starting off in Peterborough, 5 new cases from yesterday to today, bringing the total of confirmed positive cases to 83, 2,317 confirmed negative, 713 currently under investigation, 1 death, and 40 resolved cases. And a reminder that the 40 resolved cases, you can subtract that from the confirmed positive cases, so 43 active cases right now in Peterborough. In the city of Kawartha Lakes, 11 new cases reported from yesterday and a new outbreak reported. There are now 3 outbreaks in Kawartha Lakes: Pinecrest Nursing Home, Ross Memorial Hospital, and Case Manor Care Community. Now to the numbers: 138 confirmed cases, 8 hospitalizations, 95 of those 138 confirmed cases have been resolved, and 32 confirmed deaths, 28 in long-term care homes, and then the 3 confirmed outbreaks with the details we just provided. And in Northumberland County, 13 confirmed cases with 1 hospitalization. We now bring you today's update from the Peterborough Regional Health Centre. Here's Dr. Lynn Mikula, the VP, Chief Medical Executive, and Chief of Staff at PRHC.
As of today's date, Peterborough Regional Health Centre has tested more than 2,600 people for COVID-19. This is an increase of more than 1,300 tests since we announced our ramped-up testing on April 16th. The hospital currently has 1 inpatient who has COVID-19 and is being cared for in the ICU, and a second patient who was admitted with a diagnosis of COVID-19 and in whom the infection has now resolved. We have not identified any new cases among PRHC staff members. We continue to actively screen for symptoms in all patients, visitors, and staff.
Empress Gardens in Peterborough sent a note to residents and their family members yesterday informing them a resident tested positive for COVID-19. The resident is showing no symptoms and was tested because they broke protocol and left the building to have a coffee in a local coffee shop. The resident has been in isolation since April 20th. All other residents who may have had contact with the positive case have also been isolated, and staff have been cohorted to limit the potential spread of the virus. During today's PRHC press briefing, we asked how the PRHC and Public Health Unit will be working together to manage the potential outbreak.
So it's really a collaborative effort to support the long-term care homes. The testing and surveillance strategy for these homes is being directed by Peterborough Public Health. The Mobile Assessment Plus team has resources to assist in that and is certainly ready and able to do so. We also have a different role to play, which is supporting the homes with what we've learned in terms of the day-to-day application of infection control measures in this new COVID-19 reality, to use and conservation of PPE, staffing strategies, things like how to manage your lunchroom. This is lived experience that we have that we are ready and willing to share with the long-term care and retirement homes, and that we would do at their invitation. And we're very happy that some of them have invited us in to do that, and we're looking forward to collaborating with them.
At this point, Empress Gardens hasn't been in contact with the PRHC, but Dr. Mikula expects they'll be speaking soon. This week, Ross Memorial Hospital in Lindsay is creating a team to support long-term care, retirement, and congregate living facilities with infection prevention and control, education, staffing, and mobile COVID-19 assessment and testing. The hospital has piloted some mobile testing and IPAC education services and is working with the Haliburton-Kawartha Pine Ridge Public Health Unit, Kawartha Lakes Paramedic Services, and local long-term care facilities on next steps. Yesterday, Ontario Premier Doug Ford outlined framework for the reopening of Ontario's economy. Today, he follows up with a commitment to releasing more details later in the week.
This framework is the start of the process. We've already seen positive progress on the criteria we laid out. And later this week, we'll be releasing the next step in this process. Clear sector-specific labor guidelines for how businesses can operate safely in this new reality. Having a clear framework, having well-defined labor guidelines, these are critical steps to opening the economy safely. These criteria and guidelines will be based on best medical advice and scientific evidence available. Because in the coming days and weeks, as we move to open more and more parts of the economy, as more and more workplaces open up, having clear safety guidelines in place will be critical to keeping COVID-19 at bay. And putting these pieces in place will help us move as quickly as possible to reopen the economy safely. And we can't do that critical work without talking to our job creators and entrepreneurs. As I've always said, our small business owners are the backbone of our economy. Before this crisis, they employed millions of Ontarians. We know they've been hardest hit by this terrible pandemic. It's my job, it's our job to help keep them whole and help them adapt to this new normal, this new reality. So when we're ready to reopen, they can hit the ground running.
We'll be sure to bring you updates from the Premier as they come on COVID-19 local impact. Peterborough Matters is a regular half-hour program on your TV. Host Paul Rellinger speaks with Peterborough Mayor Diane Therrien and they cover local issues. The show has taken a hiatus due to COVID-19. Today, the show was recorded via Zoom. The issue of funding for long-term care facilities was discussed, particularly those municipally funded.
Yeah, so it was a motion brought forward by Councillor Keith Riel, who has been on the board of Fairhaven for several years and has been a staunch advocate for the residents there. And that's the municipally owned facility. And there's several other long-term care facilities in the community that have, and I remember this from when I was first on council, Councillor Riel, whenever our member of provincial parliament would come, would just hammer them on funding for long-term care. So this isn't a new problem. This is something that has been building up over the years, and that the amount that's tied to individual and in the long-term care facility has been fixed for quite a while, and it hasn't kept pace with either inflation or the cost of food and all of those other rising costs. And so we know that as well. A huge amount, a vast majority of cases and deaths that we're seeing from COVID are happening in long-term care facilities, not just in Peterborough City County, but across the country. And we hear about our neighbors in Bobcaygeon and what happened, at Pinecrest, and we know that there's been some outbreaks at institutions in Peterborough. And again, you have these, the workers that are working there are these ones that are seldom publicly celebrated, that aren't paid, as much as a lot of their counterparts in other healthcare fields, but are providing a really essential service. And these are, really vulnerable residents that are in there, and because they don't have, family there necessarily to advocate for them, and because things have been closed now, visitors and all of that, it's a really difficult situation. So we need to advocate for an increase in funding to help provide for these people that are in these long-term care facilities, who deserve to have good care and deserve to be safe. And so I know that this has been flagged with MPP Smith, and he's bringing it forward, and I know that they're hearing about it not just in Peterborough but across Ontario.
Having said that, I guess the big challenge, as you know, coming out of this, government at all levels is going to be strapped to provide the same level of funding we're seeing now. There's been money provided, and rightly so, to help people get through this time. We're talking millions, billions of dollars across the country. So I think you should. I agree. You should go after it, and any money that is out there. But again, they're going to be really hard pressed to provide anything additional to what we're seeing right now.
Yeah, I mean, when you see some of the subsidies that the federal government puts towards different industries, oil and gas and those kinds of things, that the money is there. It's just a question of allocation. And so, of course, long-term care, healthcare is provincial, and I know that they've been really looking hard at how they can ensure that things are being equitably distributed. So I understand 100% the challenges are tough. We know that municipally, we've had this, again, lost revenue from closed facilities, deferral of property taxes, because we're trying to help residents get through this. But then that is going to come back to the municipality to try to figure out the budget. And then that does go up through the other levels of government. But I think, anytime there's been some of these major disasters, pandemics, crises in the country, it does fall to the higher levels of government to provide that infusion to not just kickstart the economy, but make sure that its residents are looked after.
For the full interview, Peterborough Matters will premiere tomorrow night at 7 p.m. right here on your TV. As COVID-19 local impact continues, the Peterborough Public Library has some new programs. We'll share the details on them, and we'll get an update from Northumberland. Welcome back to COVID-19 Local Impact on your TV. I'm Dan Mulita. The Peterborough Public Library allows you to sign up online for a library card which gives you access to free music, movies, and ebooks. To help keep the community engaged, their Facebook page offers online book clubs, instructional craft videos, and story time for kids.
Normally you have to come into the library to sign up for a membership, but while we're closed, we actually have a form on our webpage that you can go in and fill out, and you just need to put all of your contact information, address, etc. And then we will actually we'll email you or call you and give you your card number right away, so you can have that the same day, but then we'll mail your card to you. And the cards are good for 3 months. And then after that point, if you want to renew, you can come into the library and we'll renew it for a longer period. But once you get your library card, anything that's on our library website, ptbolibrary.ca, you can access that once you have that card number. Any books or movies that people have out right now, we're just continuing to renew those, and we'll do so until the library reopens. So there's no fines on anything that people currently have in their home. The library book drop is open, although we're not able to check it every day. So if you drop something off, it may still show on your account for a few days. However, if people are more comfortable to keep them at home, that's totally fine.
My big Mr. Bullfrog here is here today to help tell stories about frogs.
Well, we've put a lot of our programs online now, so that hopefully people who were coming into the library for our story times, for instance, can log in through our Facebook page and see the same kind of interactive story times that we were doing previously. That's for children. We've got the story time videos. We're also doing a lot of book recommendations. So what we're reading Wednesday is the children's book recommendation program. And we also have Read, Watch, Listen with Karen, and that's adult recommendations, because a lot of people are now getting into ebooks, whereas before they might just come into the library and browse the shelves to find something interesting. So now we're trying to recommend some ebooks and audiobooks that people can sign out and enjoy using their computers. We have some live videos, so two of our programmers might be discussing what books they recommend for people. One that we just did recently was for people who miss Schitt's Creek, which is a popular sitcom that just ended. What are some books that kind of carry the same tone that people who enjoyed that show might enjoy? And then we also, when we're on Facebook, we have the ability to answer questions and respond to comments. One of our adult programmers, Karen, showed people how to sew their own face masks. So we knew there was a call for donations for frontline workers, but that also a lot of people in the community just want to feel safe when they're grocery shopping. So she found a recommended template and then actually walked us through how to sew your own mask and how to fit it properly to your face.
Melanie Payton has been teaching in Monterrey, Mexico for 8 years. After being told by the Canadian Embassy travel to Canada may be unavailable in the coming weeks, she made the decision to fly home. Here's what she learned in the process.
The last 8 years I've been in Monterrey, Mexico, and I teach at a private American school there. Monterrey is just 2 hours south of the border around McAllen, Texas. You know, unlike here where, you know, Trudeau's out there every day giving people information and you have, you know, they had doctors at 10 giving information, like nothing like that was happening. We figured that a lot of that information was really directed at tourists who don't have a home. You know, I have a house in Monterrey. I have an apartment. I'm safe. I was in a safe place. I was by myself. I could easily isolate. In our community, I felt safe, you know. The point was just that you're not near your family and you're not near, you know, you're not somewhere where you understand the language. And that was a big concern for a lot of us. And feeling, yeah, like we weren't hearing information. When we first got on the first flight, people were not necessarily separated right away, you know? So like there was a whole bunch of people at the back that were all sitting beside somebody else after we'd all been separated going to the airport. And that was kind of stressful until they eventually did move people around, but they didn't do it before people sat down. So that was a little, you know, upsetting. Like one of my friends ended up beside somebody else she didn't know. And that was kind of upsetting, you know, until they moved them. And then when we got into the next flight, it was a flight that was run by Air Canada or Mesa. It's like controlled by Air Canada, completely different, you know, like it just right from the get-go, it felt so organized, it felt calm, and there was constant notifications about, you know, how to safely like wash your hands and all these reminders. And then when we got to Toronto, we weren't even allowed to get off the plane until we filled out a form saying that we had a, you know, a strict kind of quarantine plan. So we had a plan to get where we were going without being with anybody. So I rented a car and then I came straight to, I rented a little house here so that I could be by myself. And I just came straight here and I have not left, you know. And my brother had left groceries for me earlier in the day, and some friends, you know, dropped off some other supplies that I needed from a distance. I must say it was very reassuring to land in Canada, you know. Being able to get information constantly and know where to go and know what to do if something happens, like that makes a huge deal. You know, I've lived in Monterrey for 8 years and I'm certainly very comfortable there and I felt very safe in my community, and I did feel like our community was doing a good job, but it's still not the same as being home.
April 24th marks the 1-year anniversary since ground was broken for Ed's House, Northumberland Hospice Care Centre. Mark Rockburn speaks with the Executive Director of Community Care Northumberland, Trish Baird, to find out how construction is continuing during COVID-19.
Right now, we meet every 2 weeks via teleconference just to have our regular, what we would have called our site meeting, but it's by teleconference. Our architect is visiting the site on a weekly basis or bi-weekly basis, but the builder, Dahlgren Construction, has taken some great measures to make sure that the staff and the contractors are safe. So they do have hand wash stations. They have ensured that physical distancing takes place. They have staggered shifts, so there's not as many people in the building, and have screened employees as they come on. So right now, I'm sure there will be a little bit of delay in the final ending of the project. We were anticipating early June, and we will find out actually tomorrow how our timeline's going, but there hasn't been anything major that they have experienced. But there are some contractors that aren't comfortable coming in. But so far, everybody's been great at keeping those measures in place. What we have found is some of the equipment that we need to purchase for the building may be delayed, and usually it's the ones that are non-essential. So what we found, the furniture for the patient rooms, things like that are essential, but the furniture for the living room may not be considered essential. So they can continue building one versus the other, which, that's as long as we can have safe patients care in the center, the office furniture will be considered essential. So we are hoping that we will still be able to have our first people into the rooms September 8th was our date. We're still going with that. But we will keep everybody up to date if that changes.
Are you able to let us know where they are currently with construction phase? Because I know that I was by the site last week and drove by, and obviously the roof's on, but there's still some work that needs to be done on the outside. So if maybe we start where we are on the outside and then go, because we can't physically see inside, where we are on the inside as well.
Yeah, so certainly from the full project, at the end of March, we were 50% completed for the full project. So that was a good place to be. It also meant that our Ministry of Health final contribution to the project comes at the 50%. So we receive a little bit of an injection of cash, which is always great. So inside, drywalls happen both down on the lower level and upstairs. They're painting, they're looking at putting in, all of the mechanical and electrical is being worked on. So I haven't been inside myself because we are not allowed on the site, have not been allowed for the last 5 weeks. But through pictures, we see that things are progressing quickly. And we would hope that, that our flooring, those types of things will be completed over the next few weeks.
As we enter another week of lockdown due to COVID-19, the municipality of Port Hope has made the decision to lay off employees. Mayor Bob Sanderson joins us to talk about the layoffs and the economic impact it's having on the municipality.
It's pretty hard on a lot of people without question, for sure. And the economic impact is becoming, a significant one for municipalities. I think the general outcome we'll have to sort it out, but right now we are dealing with individuals. In the municipality, at our last council meeting, we did authorize staff to lay off 58 part-time employees. Those employees are employees who would normally be mostly in internal recreational facilities. They are part-time, they're non-unionized, and they unfortunately, don't have any work to do. They can't work at home, obviously. And that is probably going to cost, from the municipal perspective, that's about a $12,000 a week expenditure that we would normally have. So, some of it's good, some of it's bad. The bad part, of course, is these people need to be laid off. That's the first step. As you know, we've just had another 4 weeks of emergency status from the province perspective, and I expect that'll start to have secondary impacts as well.
Can you let us know what segment of or what parts of those staff that are released from, or what what departments?
Yeah, mostly recreation. It would be the Jack Burger complex, the people who would be doing the programs on a day-to-day basis, where there are groups of people, whether it be up at the Park Center, whether it be the Jack Burger complex, and 58 part-time people is fairly significant. The only good part is I think that the government is acknowledging, recognizing that, and giving some financial benefit to those. Our next step will be, to some degree, on a voluntary basis. There may be employees who are more comfortable if they could go on to some of the emergency response systems and be dealt blows by the municipality. Public employee at any level should not be immune to this whole system. We're all in this together. And I've heard comments about the fact, well, it's all right to be working for the county or the municipality because your job is protected. That's just not true. It's got to be part of our process as well, same as any other significant employer, because that's what we are. We're a corporation. We're an employer. Our staff has to be effective. The essential services are still running. We're getting lots of emails, lots of responses, but there are some things that we really can't proceed with.
Municipality, Bob, started to look at the financial impact that is having on the municipality, because obviously you're losing revenue from rentals of halls, from sports fields and such. Maybe not sports fields so much, but that would be coming up at some point here in the next 4 weeks as well.
Our financial department is actually keeping a COVID-19 file. So when when it's all said and done, we can sort of balance the books a bit. Where were the savings? Where the expenditures? I expect for sure expenditures will outperform. We will have a lot of delayed input. Our parking, our transit, all these are areas where we would normally have revenues, but in some cases we still have expenditures.
Hopefully all those affected by the layoffs will be able to return to work as soon as possible. If you're looking forward to going out for a meal when this crisis is over, you can help make sure your favorite restaurant is still there when that happens. Currently, some of our downtown and local restaurants are finding safe, creative ways to keep making us the food we love. Part of the success of local restaurants is in the relationships they have within the community. So please, order some takeout and say hello to the people that have been feeding us for years, or buy a gift certificate to use in the future. That's our show today. We'll leave you with a nice collage of photos from local restaurants. For your TV, I'm Dan Malta.